Okay, so we move on to the next case. In this case, here, this is the case. Case number 4, this is mother with cracked nipples. That's a retraction of the nipple we have seen in the last case. This is cracked nipples. मदर का निपल में क्रैक्स है ना, कि वहाँ पे इंजरी है, हो सकता है कि क्रैक्स है, ड्राइनेस हुआ है या पेन भी है. So usually cracked nipple is a main problem and it causes pain to the mother. So it's normal that cracked nipple is there, mother is having pain. जब पेन में जो वो फीडिंग नहीं कर पाती and she is not able to feed and naturally she will withdraw from the feeding, क्योंकि बच्चा अगर खींचेगा तो उसको दर्द होगा, तो naturally वो जो है फीडिंग नहीं कराएगी. So now the problem comes when she is not feeding, there will be collection of the breast milk. बहुत ज़्यादा प्रोडक्शन हो रहा है और उसको फीडिंग ठीक से नहीं करा रही है क्योंकि उसको दर्द हो रहा है, and as a result there is collection of the breast milk in the breast parenchyma and that leads to breast engorgement. So like this the problems go on adding. Okay, now cracked nipple may be commonly because of the candidiasis. क्यों होता है? One, it may be because of the dryness. It may be because of the dryness, and the application of some of the moisturizers, oil, etc. will go in to correct it. Another is a cracked nipple may be because of candidiasis. Okay, candidiasis, a fungal infection, because if the mother is not cleaning the breast after feeding the baby, ठीक है, निपल को, एरियल को, पोर्शन को क्लीन नहीं कर रही है, सो बिकॉज इन्फेक्शन विच इज प्रेजेंट इन द माउथ एरिया ऑफ द बेबी मे बी ऑल्सो गेट ट्रांसमिटेड टू द मदर, निपल ऑफ द मदर. ठीक है, ये भी एक पॉसिबिलिटी है. अदरवाइज इफ द मदर इज नॉट क्लीनिंग द ब्रेस्ट एरिया, okay, especially nipple and areolar area, and as she is continuously feeding the baby about 10-12 times per day, so definitely वहाँ पे अगर cleanliness maintain नहीं किया, so there is every chance of undergoing candidiasis, fungal infection. So baby with oral thrush, अगर बच्चे को candidiasis है, बच्चे को oral thrush है और thrush है और वो जो है फीड कर रहा है मदर को, मदर का फीड कर रहा है, तो वो मदर को भी आ सकता है वो fungal infection, and will only this is possible. Another is those babies who are not following the proper method of feeding. Like we know that sealing is very important, isn't it? Whole black portion should be there inside the mouth of the baby, but instead if the baby is only sucking the nipple, mother is also not knowing, baby is also not knowing. Okay, mother is not aware how to give the correct position, so baby is only sucking the nipple, tip of the nipple, then definitely there will be cracked nipples and it is very painful to the mother also. Okay, so these are the common conditions why the cracking of the nipples can take place. Maybe fungal infections, okay, or maybe because of dryness, maybe because of unhygienic conditions, or maybe because of candidiasis present in the baby, and sometimes maybe because of faulty feeding positions, like baby only sucking the tip of the nipple. Okay, now application of the any oil or application of the hind milk is beneficial. Okay, hind milk क्यों है? Because we know that hind milk is rich in fat. ठीक है, सो मदर का हिंड मिल्क निकालो और वहाँ पे थोड़ा लगा दो, दैट इज ऑल्सो क्वाइट बेनिफिशियल. फैट एक्ट एज ए मॉइस्चराइजर और lubricating agent. So application of any oil like coconut oil may be important, may be beneficial. Now one of the most common combination that we will do in Ayurveda is that is a combination of the coconut oil and some amount of the honey. Honey is sandhaniya in nature. It helps for the healing, good healing, and the oil is acting as a lubricator. So that works very well. Purana madhu होना चाहिए. So that is quite useful. So application of any oil or a hind milk is quite beneficial, and we have to allow the good latch on the areola. That's very important. बच्चा जो पकड़ता है वो लैचिंग स्कोर जो हमने डिस्कशन किया था वो करेक्ट होना. लैचिंग स्कोर में क्या है? L stand for latching and A stand for
audible swallowing,
audible sound, and C stand for comfort, then T stand for type of the nipple, and H stand for hold. Okay, so now this we have to see. So latching should be proper. Application of any oil or a hind milk may be beneficial, or we have to allow the good latching on the areola. Don't allow to suck only the tip of the nipple. ठीक है, सो बहुत सारे प्राइमिस को पता नहीं होता है कि वो बच्चा जो है टिप ऑफ द निपल को सक करता रहता है, इससे बहुत पेनफुल होता है. सो इंस्टेड ऑफ इफ द होल एरियोला इज इनसाइड द माउथ, the baby is not sucking the tip of the nipple, and mother will be always comfortable, and baby is also not receiving good amount of the breast milk because it is sucking the areola total. Anyway, so this is one solution we can give. Now if the cracked nipple is there because of the candidiasis or any fungal infections or oral thrush of the baby, then we have to go for some of the antifungal solutions. Now in Ayurveda, if you are talking about antifungal, best is Yashtimadu Taila. Okay, Yashtimadu Taila added with some amount of the Spatika and Tankana. That is the best antifungal in Ayurveda, no doubt. So if you go for some of the contemporary medicines, we have got so many antifungal drugs. Okay, cotrimazole, miconazole, etc. is there. Okay, but if you're applying these drugs before giving the feeding, this breast has to be thoroughly washed. Okay, anyway, now come to the another part of this, that fluconazole. These are some of the antifungal drugs. We no need to discuss much on this, what contemporary science gives. Fluconazole 150 mg once in every 2 days till the breast pain is reduced, if the pain is there. It is also recommended. And if there is a history of persistent thrush is there, or if there is a deep aching breast pain is present, then you can go for fluconazole. Now this is important. Advise the nipple and breast care. Okay, so this is very important. Advise the nipple and breast care, irrespective of the science, maybe Ayurveda, maybe contemporary. Keep the nipples dry by frequently changing the breast pads. Suppose if you are using the breast pad, it has to be frequently changed. Otherwise, it itself is a cause for the fungal infection. Avoid using the cloth breast pads. क्लॉथ वाला जो ब्रश पैड को आप यूज़ करते हो, उससे जब क्लीन करते हो तो यूजुअली वो जो रफनेस की वजह से वहाँ पे क्रैक आने का चांसेस होता है. सो बेटर टू यूज़ सम ऑफ द टिश्यू पेपर और वेट टिश्यू पेपर्स एक्सेट्रा. Then wash the towels. The towels आप यूज़ करते हो, it should be frequently washed and clean. And then hot soapy water and air dry outside. That means it has to be cleaned properly and it should be dried properly, that particular area. Otherwise, that itself is a cause for the fungal infection. No. For the baby, suppose the baby is having candidiasis, and baby should be given with the cotrimazole mouth paint. Okay, cotrimazole mouth paint should be used. So this is about case number 4, which talks about cracking of the nipples.